Welcome to this video about neurofibromatosis type 2, or NF2. NF2 is a genetic disorder that primarily affects the nervous system, often leading to the development of tumors along nerves, most commonly the auditory nerve responsible for hearing and balance. While NF2 is primarily known for its impact on hearing, vision can also be significantly affected. In this video, we'll explore the intricacies of NF2, including its causes, symptoms, diagnosis, treatment, and what it means for those living with this condition. NF2 is caused by a mutation in the NF2 gene located on chromosome 22. This gene provides instructions for making a protein called myelin, also known as schwannomin. Myelin acts as a tumor suppressor. It helps regulate cell growth and shape. When the NF2 gene is mutated, the resulting dysfunctional myelin protein cannot effectively control cell growth, leading to the formation of tumors, particularly schwannomas, meningiomas, and ependymomas. Most cases of NF2 are due to new, spontaneous mutations in the NF2 gene. However, about half of all cases are inherited from a parent with the condition. If a parent has NF2, there is a 50% chance that each of their children will inherit the mutated gene and develop the disorder. The mutated NF2 gene leads to a deficiency or dysfunction of the myelin protein. Myelin plays a crucial role in cell signaling pathways that regulate cell growth, proliferation, and adhesion. Without functional myelin, these pathways become dysregulated. This allows Schwann cells, which insulate nerve fibers, and other cells in the nervous system to grow uncontrollably. This unregulated growth results in the formation of tumors, particularly schwannomas affecting the vestibulocochlear nerve. The tumors compress and damage surrounding tissues, including nerves responsible for vision, like the optic nerve or structures within the eye itself, leading to various eye-related symptoms. NF2 is a relatively rare disorder, affecting approximately 1 in 20,000 to 40,000 individuals worldwide. It affects people of all races and ethnicities equally. Because about half of NF2 cases are new mutations, there aren't specific populations with higher prevalence. The condition is usually diagnosed in adolescence or early adulthood, although onset and severity can vary widely. It's important to note that even within the same family, the severity of NF2 can differ greatly between affected individuals. The symptoms of NF2 are diverse and vary from person to person. The hallmark symptom is often hearing loss, tinnitus, or balance problems caused by vestibular schwannomas. Regarding the eyes, common symptoms include cataracts, often developing at a younger age than typical age-related cataracts. Visual field defects can also occur, affecting peripheral vision. Some individuals may experience double vision, eye pain, or dry eyes. In rare cases, optic nerve compression from tumors can lead to vision loss. Additionally, some individuals with NF2 can develop aporetinal membranes or retinal hamartomas, further affecting vision. Early detection of these vision-related issues is crucial to provide the best possible management. Diagnosing F2 typically involves a combination of clinical evaluation, imaging studies, and genetic testing. A thorough physical and neurological examination is essential. Magnetic resonance imaging, or MRI, with contrast, is the gold standard for detecting tumors in the brain and spinal cord, especially vestibular schwannomas. An audiogram, or hearing test, is used to assess hearing loss and balance function. An ophthalmological exam is necessary to identify any eye-related abnormalities, such as cataracts or retinal issues. Genetic testing for mutations in the NF2 gene can confirm the diagnosis, especially in cases where clinical findings are ambiguous. The diagnostic criteria have evolved over time to incorporate both clinical and genetic findings, ensuring accurate identification of individuals with NF2. While NF2 doesn't have official subtypes like some other conditions, the presentation and severity can vary significantly. Some individuals experience a more aggressive form with rapid tumor growth and significant neurological complications, while others have a milder, more slowly progressing course. The age of onset, the number of tumors, and the presence of specific complications can all contribute to the perceived type or severity of the condition. It is important to note that this variability is due to a number of factors, including the specific NF2 gene mutation, other genetic modifiers, and environmental influences. There is currently no cure for NF2, so treatment focuses on managing the symptoms and preventing complications. This often involves a multidisciplinary approach, including neurologists, neurosurgeons, otolaryngologists, and ophthalmologists. Surgery is a primary treatment option for removing tumors, particularly vestibular schwannomas, and decompressing affected nerves. Stereotactic radiosurgery, such as gamma knife, can be used to control the growth of smaller tumors or those in difficult-to-reach locations. Bevacizumab, a medication that targets blood vessel growth, has shown promise in reducing tumor size and improving hearing in some individuals with NF2. Regarding eye problems, cataracts can be treated with standard cataract surgery. Other vision problems are managed based on their specific cause, such as addressing optic nerve compression or managing dry eye symptoms. Regular monitoring and early intervention are crucial for managing the various manifestations of NF2. Since NF2 is a genetic disorder, there is no way to prevent it in individuals who inherit the mutated gene. However, for those with a family history of NF2, genetic counseling and prenatal testing can provide valuable information about the risk of having a child with the condition. Preimplantation genetic diagnosis, or PGD, is an option for couples undergoing in vitro fertilization. This allows for screening embryos for the NF2 mutation before implantation. In cases of spontaneous mutations, there are no known preventable causes. Early detection through regular medical checkups, especially for individuals with a family history of NF2, can lead to earlier diagnosis and management of the condition. The prognosis for individuals with NF2 varies depending on the severity of the condition, the number and location of tumors, and the effectiveness of treatment. The lifespan of individuals with NF2 can be shortened due to complications from tumors, such as brainstem compression or hydrocephalus. Recent research efforts are focused on developing new therapies for NF2, including targeted therapies that specifically inhibit the growth of NF2-related tumors. Researchers are also investigating gene therapy approaches to correct the underlying genetic defect. Clinical trials are ongoing to evaluate the effectiveness of these new treatments, offering hope for improved outcomes for individuals with NF2 in the future. Understanding the disease, managing symptoms, and participating in clinical trials can all contribute to a better quality of life for those living with NF2.